I'm Dr. Gwen Rodding-Patterson, and today I'd like to talk to you about weight and weight control. In our culture, 60% of patients now are either overweight or obese. This is a subject that is difficult to bring up because it is sensitive and invariably can hurt someone's feelings. And on the other hand, it is just very important to everybody. If a patient is overweight, this can affect her ovulatory status so that she can't even conceive. There are conditions such as PCOS, which stands for polycystic ovarian syndrome, and one of the first treatments for that is to lose weight. Well, first of all, weight is very important even for a woman to get pregnant. It's very important to obstetrical patients because if patients gain too much weight with their pregnancy, they're at higher risk for C-sections, hypertension, diabetes, and these issues can not only affect the mother, but they can affect the baby for its lifetime. Women typically become overweight during their pregnancy and then never lose that weight. Worse, they continue to gain too much weight with each subsequent pregnancy and do not lose that weight. So it's very important for pregnant women not to gain too much weight. How much is too much weight? Well, if you're at ideal body weight when you get pregnant, my recommendation is that 20 pounds is it. If you're overweight to begin with, I don't think you need to gain 20 pounds. If you're obese to begin with, I don't think you need to gain 20 pounds. Probably 8 to 10, 10 to 12 in there. Certainly not 20 pounds. Gestational diabetes is basically a disease that can occur when you're pregnant. You could be perfect and get it. It has to do with the placental hormones. But an overweight or obese patient is more likely, has an increased risk for having this occur. And it is a serious gestational issue. Not only does it affect the pregnancy because of what it does to the placenta and the growth of the child in utero, but it affects that child that long term, so that baby is at risk in its lifetime for developing diabetes. And what mother wants to do that to their child? Every pathological condition is increased in the obese patient or the patient who's overweight during pregnancy. Diabetes is increased, hypertension is increased, C-section rates are increased, everything, even how long the pregnancy goes, even the ability to treat pain. Who doesn't want pain control during labor? Most women do. Well, even epidurals are more complicated and more difficult to do in an obese patient or an overweight patient. So it can affect your pain control during labor. A pregnant patient needs more calories, but she's not eating for two. Pregnancy is not a license to eat whatever you want. And if you crave it, you must need it. That's all old wives' tales. It's more important to eat healthy whether you're pregnant or not pregnant. It's more important to get in shape and to become at ideal body weight before you conceive. That's what I would recommend. Weight is an important subject for gynecological patients because it can cause gynecological problems such as heavy bleeding, even cancer, and can affect one's ability to get pregnant. It can affect your ovulatory status. It can lead to endometrial cancer. It can lead to diabetes. It can lead to very dysfunctional bleeding and anovulatory hemorrhage. An ideal body weight is a BMI between 18.4 and 24.9. BMI stands for body mass index, and you can calculate your own. Just go right on your smartphone and put in what your height is and what your weight is, and it will give your body mass index, and that's how you will know. Manage your weight by calculating where your BMI is right now and what you have to do to shed some extra pounds. There's many ways to do this, but it definitely involves cutting calories and eating smart, and it definitely means exercising. So what are calories? Calories are energy units. And if you take in a lot of energy units and you don't expend a lot of energy units, you're going to gain weight. So exercise helps you burn the calories, right? But it also increases your energy level, your basic metabolic rate, how much energy you burn every day. Some people just burn more than others, but exercise increases that. So it is important to exercise, but it's also very important to control what you eat. That's the number one issue. So I would recommend that if you're trying to lose weight, you drop down to 1,000 calories a day. That's a lot of food if you eat the right food. If you eat the wrong food, you have one big piece of cake, there's 600 calories right there. So you want to eat things that fill you up that are whole food. So you want to eat an apple. You don't want to drink apple juice. You want to eat an orange. You don't want to drink orange juice because you're not going to feel satisfied after drinking some mush. You want to have to chew food and have it digested. And it will send signals to your brain that make you feel satiety. You don't have to run a marathon to lose this weight, but I think 30 minutes a day of pretty intensive exercise, even when you're pregnant. If your pregnancy is uncomplicated, it's recommended that 30 to 40 minutes of moderately excessive exercise per day is not going to harm you or the pregnancy. Swimming is an excellent exercise to do when you're pregnant. If you're not pregnant, then swimming still is a very good exercise, but running is good. Weight-bearing exercises are very good to build body muscle weight, and that helps protect against osteoporosis as well, which is a problem for the aging woman. Methods for losing weight, I have learned more from my patients than I have come up with on my own or read in books. I've had patients that have lost weight just by cutting down on their on the quantity of food they eat. I had one patient who lost 70 pounds one year, and the way she did that is as soon as she reached any level of satiety, she quit eating. She didn't change anything as far as what she ate. She ate the same things. She just quit eating when she felt satiety. And what happened there was that as time went on, she reached satiety sooner and just quit eating. It was remarkable, her results. She had the results of somebody who had barometric surgery. I had another patient that lost weight by cutting out all quote-unquote white food. No rice, no potatoes, no dairy. Essentially, she was cutting out all carbs. no noodles. I had another patient that lost weight by doing this. She just quit eating. She pushed away from the table. That was her favorite exercise. But it does involve some discipline. The other issue about losing weight is when you do lose weight, you just feel better about yourself. You're happier. And I think if you just project positivity, you enjoy life better, and that's huge. Our culture is plagued with depression, and this is a way to fight it. You're not born happy. The world is not always a happy place. You have to fight it and be happy, and I think that's a really big issue of embracing life and enjoying life. And the other issue, as you get older and you haven't lost weight, it's harder to lose weight because you can't exercise like you used to. And every pound overweight translates to 4 pounds at your joints. And next thing you know, you need joint replacements, and overweight people have more complications with surgeries. They have more infections, more serious complications like venous thrombus embolisms. Lose weight and get in shape before you're pregnant. Pregnancy is not the time to do it. Pregnancy is a time to continue to be healthy, eat healthy, but obviously it starts before you're pregnant. This has nothing to do with weight, but folic acid, it's better if you take that 3 months before you get pregnant than when you're pregnant. It will prevent neural tube defects. That's a congenital birth defect that affects the spinal cord. And it's better that you're on folic acid before you're pregnant than just when you're pregnant. That's true with weight as well. Lose those 15, 20 pounds so that you're at good weight when you start. If you don't, then your pregnancy is going to be at risk for diabetes and hypertension. A large baby. It doesn't take a rocket scientist to recognize that a baby that weighs 9 pounds is going to be much more difficult to birth than a baby that weighs 7 pounds. Huge issues there. And it does increase the C-section rate. And a C-section on a patient who's obese or overweight has much more complications of infection and venous thrombus embolism. Those are blood clots in the legs or the lungs, than somebody who is at ideal body weight. So again, the reason I'm so concerned about your weight as your obstetrician is not to hurt your feelings. It's not to be nosy. It so affects whether you can conceive to begin with, and it affects the pregnancy itself, and it affects the child.